and we open the door for any candidate for elected office, regardless of your party affiliation, to come and share. Okay? So, having said that, if Rob Whitman or someone else from another party wanted to come and share, by all means, we're willing to listen. Okay? Without further ado, let me take this time to introduce one of our primary leaders in our organizations, I started to say sister, Ms. Lisa Shivers. If you will come and introduce our first presenter. Sure.
So before I introduce Leslie, I want to ask if all of you have seen our new website. So Susan McFadden spent a lot of time this summer working on our new website, and instead of being .com, we're .org now, and it's very phone friendly too. So I encourage everyone to have a look at this. She spent a lot of time on it, and if you have suggestions of things you'd like to see on it, my email is attached to this as the interracial conversations person to reach out to. So it's there. Feel free to reach out to me if you've got anything you want to share, you want to see on
Can
it.
you share the website, because I'm not sure what that is?
It's interracial conversations, nnk.org.
Thank you.
So, and it truly is great. Lots of pictures from the Montgomery trip and things that we've done, things that we want to do. So tonight we are, as Tyron said, we are lucky to have two presenters. My neighbor, Cindy Rogers, asked me a couple of months ago if I would be interested in hosting a meet and greet with Leslie Mehta, and I was thrilled to do that. So it started out a couple months ago with us trying to figure out how we were going to do this, when we were going to do it. And when we went to the Labor Day picnic, we ran into Hannah, who is Leslie's campaign manager, and said, you know, when might she be available? We were just bantering around some ideas, and I thought, I wonder if she'd be available the same day as interracial conversations, so we could do a twofer. And it's turned out to be a whole day of activities that we've had. So we started at Cindy Rogers' house with a luncheon from 11 to 1 with about 45 people. Then Leslie went on to the hospital and had an hour tour with the director of nursing, I think it's who it was, and learned a lot about healthcare in this community also. And then we went out, we took her out to the end of Windmill Point Road, where she had the opportunity to meet Callie Hyde. Callie and her husband Thomas are 29-year-olds who started an oyster business. It's Steamboat Wharf Oyster Company. And we also got to experience a little bit of global warming because we had to drive through a lot of flooded streets and roads where after we were there, we're like, I don't know if we're going to get back out again. So yeah, that was a little bit of excitement. And then we got to go up to Mom Margaret's and meet with Alva Jackson, where she served us a light dinner and got to share the Northern Neck Hidden History Trail and a little bit about Mom Margaret. So I'm sure Leslie is exhausted, and she's got such a lovely smile on her face, and I know she's happy to be here. I know you all will love to hear her message. So rather than me read her bio, I printed out 50 copies of her bio that are there for you to take with you if you'd like to. But I think she'll touch on all of this when she presents. So welcome.
Glad to be here. I'm excited. I see a few familiar faces, so that's good too. Yeah, I am Leslie Mehta, and I'm running for Congress in the 1st District. And I'll just start, since I see a lot of faces that I don't recognize, I'll start a little bit by telling you about me and my background, and then we'll go from there. So I'm a lawyer. I've practiced for a little over 20 years, and I'm the former legal director of the ACLU of Virginia. While there, of course, I handled constitutional rights, making sure that people had their rights protected, regardless of party or regardless of their underlying beliefs, making sure that everybody had fair and equitable treatment under the law. And in 2017, things changed for me. I was still working at the ACLU of Virginia and head of the legal department, but my oldest daughter, Brooke, was diagnosed with a rare disorder called Rett syndrome. it typically renders you incapable of walking, talking, or having purposeful use of your hands. And they develop typically for the first couple of years, and then they start regressing. Cognitively, they're on par with all the other kids, but their physicality, they start regressing. And for me, what ended up happening was I felt as though I needed to do something. You know, Michelle Obama has said that recently, do something. And I didn't have a medical background, but I wanted to be able to figure out what I could do to help the situation and help other people in those predicaments. At that time, Brooke had, after her diagnosis, she was denied Medicaid twice before she ultimately got it. And she was essentially kicked out of one of her daycares, but because they said they didn't have the resources to be able to help her. And so I started reaching out to Democrats and Republicans and talking to them about some of the challenges that I faced and some of the hurdles that I had, just really with the issues that I talked about earlier and some things that I was anticipating happening. And so I started, I connected with Abigail Spanberger, and at that time she wasn't even elected. This was her first run for Congress. And we started talking about rare disease and scientific research funding and making sure that people had access to the resources that they needed. I also told her about the fact that, you know, we wanted this eye gaze device that allows, because she couldn't talk, it would allow her to look at the pictures and see what the things were that she wanted to say. And as a new mom, ultimately being able to get that through Medicaid, I was able to hear, "I love you, Mommy," for the first time because of that eye gaze device. And so when I talk about Medicaid and the resources, I'm very passionate about that because there are everyday consequences to either being able to have Medicaid or Medicare or not. We had private insurance, but Medicaid was the key to a lot of those additional resources. And so as I talked to Abigail and others, we started talking about that, and I was able to ultimately get research funding passed as a result of that. Hundreds of thousands of dollars went to scientists for research funding for scientific research treatment. Everyone I asked to sign on to it did so, Democrats and Republicans, except Rob Whitman. And I still don't know exactly why. You know, as I say often, Republican kids get sick too. So it's not, you know, it's not just a Democratic thing. And I continued. I said, well, you know, I don't have to just focus on what he's doing. I can continue doing the work that I was doing. And just organically, I started tying into some of the issues that I'd been excited about as an ACLU lawyer, having done civil rights for a significant amount of time, and the kinds of advocacy that I had in that space, and working with more and more Democrats and Republicans on those issues. And in 2021, my brother passed away from Rett syndrome at the age of 5. And I was, by that time, I had already left the ACLU, and because of all of the issues and all of the things that were related to her that I really needed to manage, my husband and I. And so I was kind of looking for what was the next thing that I would be working on. And again, I had started kind of expanding it to some of the issues that I'd been working on as an ACLU lawyer and wanted to continue to expand on things that were important to me. And that is what I want to bring to this office. That some of the things that I'm very passionate about include affordable and accessible health care. We've been talking, Cindy and Lisa and I, talking to folks today even about the disparities, and not just in terms of affordability, but accessibility, particularly here in the rural areas. It is important for me to have access to the health care. It's, of course, paramount to have affordable health care, but it doesn't mean anything if you can't actually get to it. And we were talking about not having a maternity ward. I can't even imagine having to go, an hour and a half to get to a maternity ward. As a mom, a new mom, someone who's nervous about what's going on, and you're having to go to so far and plan in that way to try to just get the resources that you need. And we have talked to a lot of people who have concerns about this post-Roe era that we are in, based on the Dobbs decision. And one of the things that has been important for me, not only, of course, the fact that they have been running on a national abortion ban, and Whitman has had a life at conception bill that was would have been a national abortion ban, no exceptions, and no carve out for IVF protections. It's very important to me personally because my two girls, my daughter who passed away and my other daughter, were IVF babies. And I cannot imagine being in a circumstance where you have, you've had miscarriages like I have. You've spent tens of thousands of dollars on IVF, and then somebody you don't know from somewhere else is telling you, you can't go through this process being a few shots in because of some political reason. When you're trying to grow your family in the way that you can grow your family. And so it is important to be able to make sure that we have someone in who is fighting for those rights. Another thing that has been particularly important, and we've talked about it, climate change is incredibly important. And not only is it important in general, but you guys here see the effects and the impacts on a daily basis. When we're talking about severe flooding, and we're talking about air quality and water quality and in the Chesapeake Bay and all of the things that we're talking about experiencing, it's important. And on everyday basis, I know often people think about the federal government being kind of lofty and up here, but there are things that affect and impact our everyday life. We talk about gun safety. One of the things that I've been hearing as I go up and down the district to all 18 counties and cities and talk to people is that gun safety, just common sense gun safety laws are incredibly important. It is not about taking people's guns away. It's about being responsible gun owners. And so as I talk to lots of folks who have had concerns about it, moms who have had children who have passed away from gun violence or who have been hurt or even just traumatized from seeing gun violence, they have gone to Mr. Whitman to try to talk to him about some of these issues. And from my perspective, it seems like he's been incredibly flippant about it. He'll say things like, it's important to be able to get a gun ASAP in case you want a particular hunting trip that spare the moment. And you want to be able to get the gun immediately because you left your gun at home. That's why it's important to have, basically no rules about it. And you're talking to someone about something like that who may have lost a child or has witnessed gun violence. And we need something better than that. And I've talked to Lori Haas on a number of occasions, who is a gun safety advocate, whose daughter got hurt at the Virginia Tech shooting. She lived through it, but she got hurt. And she said, we have worked hard to try to change people's minds when it comes to gun safety. But at this point, if we can't change their minds, we have to change their seats. It's important to get people in who know the importance, who know the value of being able to have reasonable gun safety solutions. And particularly important for me is investing in public school education. I grew up in a small rural town in North Carolina, just across the border. And if you know where Roanoke Rapids is off of 95, it's near there. Small little town of 800 people. And I ended up going my first 2 years of high school to that small rural town high school. And my last 2 years of high school, I went to the North Carolina School of Science and Mathematics in Durham, North Carolina. It was a residential high school, and it was public, but you had to apply to get in. And so I knew that technology and the administrative portions and all of that stuff with regard to the public school education that I was going to receive at the School of Science and Math would be different. What I didn't realize is that other folks having had more resources in Raleigh, North Carolina, and Charlotte, North Carolina, from the old schools they came from. So that, to me, that says that it's important to make sure that all of the schools, not just the schools in cities, in the big cities, are having the resources that they need in order to have the quality of public school education. It's imperative in all of the areas, and it shouldn't matter what zip code you're living in. And so these are some of the issues as we go up and down the district talking to people, they're resonating with. And not only that, people are tired of the antics. They're tired of entertainer-in-chief. They're wanting somebody who is sensible and being able to make sure that things are done and in a bipartisan way when possible. And for me, after I'd done that work on the federal level with Abigail Spanberger and others for rare disease, Governor Youngkin's team reached out to me to do something similar on the state level. So it's important to me, you know, I don't agree with him on everything, but when there was an opportunity to work together to make a difference with rare disease, why would I say no to that? And that is the crux of what I'm trying to get at. Being able to work together again and come to common sense solutions on issues. We may not agree on everything, but there's something, the core of it, that we can do together. And so that is what I want to do, and that's what I want to bring to this office. We, on the first day of early voting on Friday, we saw lines out the door continuously in a number of different jurisdictions, and that was very exciting. Folks were getting out and supporting, but we still have 42 days left. And so for folks who haven't voted yet, I would urge you to get out and make your voices heard by voting. If you've already voted, there's still stuff for you to do. You can connect with your family members and your friends and tell them to get out and vote. And I will tell you, this has not just been resonating with Democrats. This has been resonating with moderate Republicans who are just tired of the antics. And talk to your moderate Republican friends, because they don't have a political home right now. And they want to see common sense done too. We can get back to, you know, talking about the intricacies of some issues later, but right now we have to focus on making sure, instead of talking about eating cats and dogs, that we're talking about real issues that are important to everyday people. And so that's what I want to bring. We've had folks up and down the district excited to knock doors. We have had folks, the college students in particular, they have been knocking so many doors that we have them knocking maybe 4,000 doors every weekend. Yes, and some people have had multiple times people coming to their homes, and they say the first time, oh, I don't know who Leslie Mehta is, but then they come back and they're like, oh yeah, I've heard about her. So talk to your friends, and the more they hear it, you know, the lady with the funny last name, it resonates. And they hear more about what I'm about and my bipartisanship and how I want to work with people. Of course, if people are interested in not knocking doors but want to do phone banking, there are ways for you to do that as well. And of course, if you have a few extra dollars, you can always donate those to our campaign so that we can be out in all of those spaces. We're trying to get a program that is inclusive of all areas so that we can make sure we get out the word about not only about me, but really breaking down that facade that Whitman is a moderate. He's not. He had a national abortion ban. He is an election denier. He voted against certifying the election results in Pennsylvania. These are issues that are important and issues that people are connecting with, because sometimes people forget. Look, he had he voted against the infrastructure bill. And then he shows up, he doesn't lie, he'll say, this infrastructure bill passed. Not saying he didn't vote for it, but then he'll show up with a hard hat and the vest or cutting ribbon. It's important to break down that actual facade. So one of the things we're going to be doing is having TV ads so that we can talk to a more inclusive, a more expansive group of people about me and my background, but also what he hasn't done in his 17 years in office. So I'd love to have additional conversations with you, but I again wanted to thank you for allowing me to be here. And I hope that you're with me to flip this seat in November. All right, thanks. Any questions? Oh, yeah.
Senator, thank you for your presentation and your passion and enthusiasm. I want to go back a little bit more to the health issue.
Sure.
And hear your advocacy positions for how we can address both from the healthcare resource side, so recruiting health professionals into rural health in this area, but also facilitating, and there's wraparound to facilitate access to those services. For example, how do we assist our elders in getting that transportation to the medical appointments and safely back home? How do we help build infrastructure so that we can have better relationship with health advocates who may even visit our elders in their home? How do we look at infrastructure for telemedicine? Just as some initial thoughts to hear some of your advocacy positions.
So healthcare equity is incredibly important to me, particularly given my personal relationship to it. We were at the hospital earlier today, and a lot of it boils down to increasing funding. We have talked to people who say we just need the resources to be able to get, expand the hospital or be able to have quality folks come from different areas. Sometimes the wraparound services or the making sure that the region or the community, that it needs to be enticing for people to come in too. I've heard from many people about, there might be doctors who come in who are nearing the end of their career and they're wanting to retire, and that's great. But it would be nice to be able to attract other people as well who will be in the community for a longer period of time. And so in order to do that, people have to feel like, we talked about, you talked about telehealth. People want to make sure that they have broadband access uniformly. They have to, in telehealth in particular, making sure that people have that resource when they either can't or don't want to go to the doctor's office itself. We got to make sure that broadband is available consistently around. But a lot of these issues that we're talking about are the resources that we need to input into our community and input into our healthcare facilities. And we're not going to be able to attract people who want to stay for longer periods of time if they feel like the other additional services are not supported in the community. Thank you. Yes.
I know you mentioned visiting the hospital, that Fawn Secure that you visited?
Yes,
Okay. I do want to introduce you to Dr. Marsh, who's over the Northern Neck Middlesex Clinic.
Hi.
And then Jeannie Nelson, who's the CEO of the clinic.
Oh, hi. It's so nice to see you. Thank you. Thank you for being here.
You met Vicki Kinsel. She's our chair today at lunch.
Yes. Oh, okay.
So I'm here with the packet.
Oh, yes. Okay. All right. Just saying. Yes. Thank you. So tell, are there any concerns that you have as healthcare providers that you think that I should be addressing or thinking about that haven't already been addressed? Don't mean to put you on the spot,
Yeah. I have lots of ideas.
but okay. All right. Well,
I've been doing it 32 years,
Okay.
so bringing those layers from corporations to the all the different partners that often can be in silo situations. So, yeah, I do have a lot of ideas. 32 years taught me a lot.
Yeah, and you know, one of the other things about that for me in particular that I've been hearing is when it comes to Medicaid and Medicare, it's been challenging because reimbursements aren't, you know, they are not as high as with private insurance. So then it makes it more challenging for people to accept Medicaid and Medicare because they have, you know, they either have to increase the number of patients that they have in a day, and that can affect the quality of the experience, or it's just that they just can't do it in order to keep the lights on, you know, that kind of thing. So I don't know if that has been your experience with
Well,
Medicare.
we were a free health clinic, and there's a number of different clinics. So
Okay.
when 2019, the state came to us and asked us to step up and be a hybrid model. So now we have, yes, we do that because of the number of coming into the system. But it's also extremely challenging because people are in it and out of it. And
Yeah.
so there's a lot of, and it takes 3 months to get a doctor credentialed. So maybe you could work on that.
Oh,
'cause,
wow.
it takes a while, right.
Oh, okay. Well, I did not know that.
I mean, that's because if we bring in locums, because if we don't have a doctor and we have to work with the different locum agencies, you know, for one, it's very expensive. We have to pay their housing, their mileage, and flying them in or whatever.
yeah.
But they also, if we can't get anybody credentialed in Medicaid in Virginia, that's it means lost revenue. But, you know, and the revenue is actually better in dental than, yep, than medical. But,
Okay.
so, but, you know, they're way behind in dental, so
Okay.
part of that. They just added dental to Medicaid for the adults and
Oh,
a
really?
couple
I
years
didn't know
ago.
that just happened. Really?
Yeah, so I got lots of ideas.
Okay, all right. Make sure you get a card. Any other questions? Well, thank you so much. I appreciate it.